everyone. Thank you for joining today's webinar. We're going to be talking about navigating Medicare open enrollment with confidence. Medicare can be daunting, and if you feel that way, you're certainly not alone. Whether you're approaching retirement age, already utilizing Medicare, or maybe helping a loved one make informed decisions about their own care, understanding the options is crucial. And with Medicare's open enrollment period starting today, kind of funny. I don't know how we did that exactly, but we're actually hosting this on the day that open enrollment starts. It's important to understand what you need to know. So those of us at Mariner are co-hosting this webinar with Chapter. Chapter is an independent Medicare advisory firm who provides unbiased, holistic health care guidance to their clients and our clients. My name is Chad Hamilton, and I lead the practice management team at Mariner. I'm joined today by Lisa Fentress. Lisa is a senior wealth advisor at Mariner, along with Ari Parker. Ari is the co-founder of Chapter. He's one of the nation's leading experts on Medicare, and he's helped thousands of Americans sign up for Medicare. Ari's been featured in the New York Times, CNBC. He's been in this space for at least 20 years, and he trains and leads a team of, I believe it's over 30 licensed Medicare advisors now. Chapter's a strategic partner of Mariner, and they support our advisors and clients with all things Medicare related. In fact, this is a concierge service that we offer clients of Mariner at no additional cost. So we appreciate all you and your firm does for your clients, Ari, and appreciate you being here today on what I'm sure is a very busy day for your firm. And of course, this topic can be incredibly confusing, and so it's our hope today that you find clarity and walk away with a new sense of understanding. So if you've joined one of these events before, you know we get a lot of questions. This will not be an exception. And we'll do our best to answer those. We won't get to all of them. But I would encourage you to utilize the Q&A feature on your Zoom panel to submit your questions along the way, and then we'll leave some time at the end to address as many as we can. Also, this call is being recorded, and it will be sent to everyone who's registered for this. It will also be posted to the Mariner website. I would say give us a little more, a week to 10 days or so, and we'll have that up on our website and on our YouTube channel. Okay, so with all of that, I want to just look at our agenda for today. So the first thing we're going to do is spend some time talking about basics, Medicare 101. What are some of the things you need to know to make an informed decision about Medicare? Then we want to help you understand your options, how you choose a Medigap versus Medicare Advantage plan. How do you make the right choices, and then prepare for annual enrollment and changes for 2026. We do also have a special offer for you. And so up on the screen, if we can go to the next slide, you can actually scan this QR code and get a free copy of Ari's book called It's Not That Complicated: 3 Medicare Decisions to Protect Your Health and Money. So anyway, this is your chance. Grab your cell phone, take a picture of that QR code if you'd like to get a copy of that. We'll give you a chance at the end too, in case you don't do that right now. Um, and I think with that, I'm going to hand it over to you, Ari, and maybe you can help us get started just by maybe understanding the key components to Medicare.
Thank you so much for inviting me to present, Chad. It's an honor to be here with Mariner. We are your official Medicare partner, and we're looking forward to helping so many Mariner clients review your Medicare coverage. You can begin reviewing your Medicare coverage today, and you have until December 7th. So with that, let me give you a little bit of background about Medicare. By the end of this presentation, you're going to know more than 99% of people about Medicare. So share that knowledge with your friends, family, and loved ones. Picture Medicare as a 3-legged stool. The first leg of the stool is hospital coverage. The second leg is everything outside the hospital. And the third leg is drug coverage. Each of these legs corresponds to a part. Hospital coverage, that's Medicare Part A. Outpatient coverage, Part B. And finally, drug coverage, Medicare Part D. Part A and Part B are called Original Medicare because these are the twin pillars that were established in the mid-1960s. So let me turn to these key components now. Part A is your hospital insurance. This also covers skilled nursing facility care, home health care, or hospice. It means you have a wristband. If you don't get a wristband at the hospital, then you're being held for observation, and Medicare doesn't cover being held for observation. So if you go to the hospital, make sure you get a wristband. You're wondering, that sounds great. I get hospital coverage. How is it paid for? Part A is paid for through your federal payroll taxes. If you or your spouse has worked 10 plus years and paid federal payroll taxes, then there's no premium for Medicare Part A. There is a deductible. It's substantial. We'll talk about how to cover that deductible a little later on. Then there's Part B. Part B is your outpatient coverage. This covers visits to your primary care doctor, visits to specialists. It also covers lab work, x-rays, MRIs, CT scans, even durable medical equipment, like a continuous glucose monitor, a heart monitor, a wheelchair, or a walker is billed to Medicare Part B. Now, there's a monthly charge for Part B. The standard Part B premium for 2025 is $185 per month. $185 per month, and there's no family plan. So if you and your spouse are each on Medicare Part B, then you owe $185 per month each. And if you're a high earner, you're going to pay more. And Lisa and I will talk about that a little later on. But the standard Part B premium for 2025 is $185 per month for Medicare Part B. So let's talk about what you get in return for that. In return for paying that Part B premium to Uncle Sam, you get 80/20 coinsurance. The government picks up 80%, you owe 20% out of pocket. My mom lives in the Chicagoland area. She received a knee replacement over the summer. It's a $50,000 procedure. Had she not had some type of additional coverage, my mom would have owed $10,000 for her knee. Each doctor visit thereafter, she would have owed 20% out of pocket as well. So her out-of-pocket exposure for this year would have been well north of $10,000 had she not had some type of additional coverage. So the important thing to understand is that original Medicare is not comprehensive insurance. It leaves you paying 20% out of pocket, and there's no cap on that 20%. The sky is the limit. What's more, it doesn't cover long-term care. Lisa, do you want to go over that?
Yeah, Ari, this is something that we cover a lot with clients is whether or not they should self-insure or whether or not they should get some kind of long-term care insurance or hybrid policy, long-term care life hybrid, to help them fund this problem. It's like they have to decide as a family. If they have the money, sometimes they decide to get long-term care. I call them Cadillac policies, and that helps pay for everything. If they don't have the money, sometimes we do a long-term care life hybrid, and that way, if you don't use it, you don't lose it. So traditional long-term care, if you don't ever use it, it doesn't activate. You still pay the premium every year. And long-term care life hybrid policies allow you to say, well, if I live a good, healthy, long life, then I get the life insurance at the end. And if I don't need the long-term care insurance, it applies to that. And it's very important because there's a lot of things. Again, the ADLs, if you're not familiar with these, are eating, bathing, dressing, toileting, transferring, and then of course cognitive decline. And that's one of the ones that most people fear. They bring up with us most that they're most worried about, well, who's going to take care of me if I have dementia? So we do bring this up in planning. It is an important part of the conversation, and Medicare does not cover it.
That's right. There's no coverage under original Medicare for long-term care. And long-term care is known under synonyms: nursing care, around-the-clock care, custodial care, 24/7 care. No coverage under original Medicare for long-term
Assisted
care.
living.
That's right. So best time to have that conversation with your Mariner advisor would be in your 50s or your early 60s. By the time you reach 65, it's oftentimes too expensive to insure for long-term care, even if you're healthy enough to qualify. With that, let's turn to the final leg of the stool, Medicare Part D. This is going to be a surprise to some of you, Medicare Part D comes from a private insurance company. It does not come from the government. The government does Part A and Part B. It does not do your prescription drugs. In order to get prescription drug coverage, you have to go through a private insurance company. Now, the reason to get drug coverage is first, if you take medications, you're going to get a lot of copay relief when you go to pick those prescriptions up at the pharmacy. Even if you don't take any prescriptions, it's still recommended to get Part D coverage because first, what if you have a prescription that's added during the course of the year? Then you're going to want insurance for that medication. And second, there's a lifetime late enrollment penalty if you don't sign up timely for Medicare Part D. And the only people who have an exception to delay signing up for Medicare Part D are those who receive coverage at least as good as what Medicare Part D would offer. So we're going to talk about how you can secure Part D coverage, but you should know that there's only two ways to get it, and they're both from a private insurance company. With that, I want to talk about improvements that are on the horizon for Medicare Part D. There are three significant improvements in store for 2026. In order to action these improvements, you need to review your coverage before the December 7th deadline. So make sure if you do anything from this presentation at all, if you're already on Medicare, review your coverage for 2026 before December 7th. So the three improvements that are in store. First, there's going to be a maximum out-of-pocket cap of $2,100 on your prescriptions for 2026. Previously, for the first almost 2 decades of the Medicare Part D program, there was no maximum out-of-pocket on seniors' prescription costs. So if you were on an expensive brand name or a specialty medication to fight cancer's metabolic pathways, for example, there are some remarkable cancer-fighting drugs. You could have owed $10,000 to $15,000 for those types of brand name or specialty medications. That's no longer the case for 2026. Instead, the maximum out of pocket is going to be $2,100 on your prescriptions, but the key is that the plan you choose must cover each of your prescriptions. If it doesn't cover one of your prescriptions, then that medication is not subject to the maximum out of pocket. So very important to review your drug plan for 2026. The second improvement that's on the horizon is that previously, when you went to fill your medications, you could have owed thousands of dollars up front for the first time you went to fill that expensive brand name or specialty medication. Now, insurance companies are going to automatically apply smoothing. So even if you reach that maximum out of pocket, you're going to owe a little less than $200 per month rather than having to fork over the full $2,100 at the beginning of the year. And then the third improvement that I want to mention here is that Medicare is going to be negotiating the price of 10 select medications on your behalf. And if you take one of those 10 medications, then good news is in store. Your price is going to be a lot lower if you take one of those 10 medications that Medicare is negotiating over. And if you have any questions about which medications are covered, you can always email us at mariner@askchapter.com, and I'm going to have that email address up when we reach the FAQ section as well. So the question that I want you to have top of mind is you know that original Medicare, Part A and Part B, only cover 80% of your medical expenses. You owe the other 20% out of pocket. So if you're hospitalized, you owe a deductible for each hospitalization. If you have an outpatient surgery, you owe 20% of that procedure, unless you choose some type of additional coverage. And what's more, original Medicare doesn't cover prescriptions. You know Part D is separate. And it also doesn't cover dental, vision, or hearing. Dental, vision, or hearing actually isn't covered by original Medicare at all. So when Mariner clients realize that there are these gaps in their original Medicare, it's what prompts them to reach out to the chapter team in order to review their coverage. And though there are 24,000 plans nationwide, we can broadly sort those 24,000 plans into one of two types. Option one is to keep your original Medicare and add a Medicare supplement plan, which is also known as Medigap. Tomato, tomato. Medicare supplement and Medigap are synonymous terms. And I like referring to it as Medigap because it allows you to picture through your mind's eye exactly how it's working. It's covering the 20% you would otherwise owe out of pocket. If you choose option one, then all you need to do is add a standalone prescription drug plan. Then there's option two. Option 2 is what you see advertised on television. You could pick your favorite Medicare Advantage spokesperson, Joe Namath, William Shatner, Jimmy Walker. They're talking about Medicare Advantage plans. Medicare Advantage is known under synonyms, Part C, all-in-one. Those are all synonymous terms for Medicare Advantage. These plans are a replacement for original Medicare administered by a private insurance company. It's managed care. Here's where we're in the world of HMOs and PPOs. We're in the world of network restrictions. We're also in the world of prior authorization. And there were over 50 million prior authorization claims in 2023 alone. So simply put, if you can afford it, option 1 is the most comprehensive and flexible. If you can afford option 1, then that is what most Mariner clients tend to choose. So let me go over why most Mariner clients tend to choose Medigap. The reason why is they appreciate not having to worry about whether their doctor is in or out of network. It's better than a PPO. You can see almost any doctor or provider nationwide who accepts original Medicare as long as they're taking new patients. If you ever have a question about whether your doctor accepts Medicare, you can simply call the chapter team. We'd be delighted to help you. The second reason Mariner clients tend to choose Medigap is because they appreciate the freedom to be able to see any specialist nationwide without a referral. For example, if you want to go to the Mayo Clinic, the Cleveland Clinic, MD Anderson, which is probably the nation's leading cancer research institute, you can go to those institutions no problem if you have Medigap. The next thing that Mariner clients tend to appreciate about Medigap is the cost certainty. So your deductible under Medicare is $257 for this year. Your Part B annual deductible for this year is $257. If you compare that to my deductible is $6,000. My wife, daughter, and I don't see a dollar of benefit until we fork over $6,000 for the year. Under Medicare, your deductible is $257. And here's what's more. Under certain Medigap plan letter types, your out-of-pocket is also $257. That's why I can't wait to be on Medicare. And then finally, that's right, Lisa, I can't wait. The final thing is Medigap is designed to last a lifetime. It's standardized under federal law. So the way that I train our team is marry your Medigap, date your drug plan. You're making a 30 to 35 year purchasing decision when you sign up for Medigap. So we spend a lot of time helping you optimize that decision. And then every fall, we review your prescription drug plan. So marry your Medigap, date your drug plan.
I like that.
Let me go over the most comprehensive Medigap plan letter type for someone who recently turned 65. It's Medigap plan letter G. G is in George. If you have Medigap plan letter G, which is standardized under federal law, meaning regardless of the insurance company you choose, if you select a standard plan G, it cannot vary on the hospital and medical benefits it offers. And here's what it'll cover. First, there's no network restrictions. Second, there's no referral required for a specialist visit. There's no additional bills or copays once you hit your Part B annual deductible, which is $257 for 2025. It works nationwide, so if you winter in Arizona or Florida, it's no problem. If you own an RV and you love to hit the road, no issue seeing doctors when you're in a different state. And finally, it includes 80% international coverage for the first 60 days that you're outside the United States. And Lisa,
we see that as a question out there, Ari, that they're asking, what about coverage outside of the US? So that it's good to know that G covers international.
Correct. Certain Medigap plan letter types, Plan G, Plan F, Plan N, provide 80% international coverage when you're abroad for the first 60 days that you're outside the United States. And Lisa, let me tell you a little story. We were helping a Mariner client last fall, and they suffered a heart condition while they were traveling in Paris. And they needed to be hospitalized for 2 weeks. They racked up nearly $30,000 in hospital expenses. Because they were on Medigap plan letter G, our member advocate team was able to help them get $24,000 in reimbursement, so it didn't ruin their trip.
That's great. And I'm seeing a lot of questions in the chat, and some of those we'll try to answer towards the end. But also, people are having trouble with their drug plans. Like I'm hearing a lot about that, and also confusion around this option two and why they should even do a different kind of plan.
Great. Let me talk a little bit more about option two then. Thank you for teeing it up. Remember, option two is Medicare Advantage, and it's one or the other. You can't have Medigap and Medicare Advantage. That's illegal. It's one or the other. Under Medicare Advantage, you continue to owe your Part B premium to Uncle Sam, and the standard Part B premium for 2025 is $185 per month. Medicare Advantage is a replacement for original Medicare administered by a private insurance company and subject to that private insurance company's terms and conditions. And I'm a lawyer by training. There are hundreds of pages of terms and conditions if you choose Medicare Advantage. This is where we're in the world of network restrictions. So we need to go doctor by doctor and make sure that they're in network with the plan of your choosing. Otherwise, you're going to pay a lot more at the time of service. Medicare Advantage is also subject to prior authorization, meaning the insurance company gets a veto over the care that you and your doctor think that you need. So if you can afford it, option one is the way to go. Instead, if you want to make a bet on your health, option two can work, but the problem is it's pay-as-you-go insurance. So we want to make sure that it's actually reducing your total healthcare costs over the lifetime that you have it. So option two just comes with trade-offs. And so that's the type of education that we help walk you through when you meet with our team. So here's the framework that we use in order to help you assess between option one and option two. We call it the 3 Ps. And this is what I write about in my short best-selling book on Medicare. It's not that complicated. The first P is your providers. What doctors do you see? What institutions do you want to go to? The second P is your prescriptions. What medications do you take? Brand name or generic? What pharmacy do you like to go to? A national chain or a mom and pop drugstore? And then the third P is your priorities. What's important to you? Do you own a second home in a different state? Do you have a grandchild on the way, but they live a long ways away from you? Do you plan to travel internationally? All of this factors into finding the single best fitting plan for your needs. And this is the type of conversation we have with you in a 45-minute phone call with one of the dedicated Medicare advisors on our Mariner team. The 3 Ps. Write out your 3 Ps. That's what I recommend, and I'm going to touch on that more because right now is the time you have to optimize your coverage for 2026. Right now, we are in the Medicare annual enrollment period. As Chad mentioned at the outset, it started today and it ends December 7th. So over the next 53 days, make sure that you review your coverage. During the Medicare annual enrollment period, you can, if you've been on a Medicare Advantage plan, you can change your Medicare Advantage plan. Alternatively, if you've been on Medicare Advantage and you say, I don't like the way that it worked, you can go back to original Medicare, and we might be able to help you find a Medigap plan. And then during the Medicare annual enrollment period, that's also the time for you to shop your prescription drug coverage.
That's certainly the concern that I'm seeing in the question and answers right now, Ari, so clarify again for them. Open enrollment is where they can make the changes.
Correct.
And if they have any confusion about what change should I do, they would be emailing mariner@askchapter.com and getting the questions from your team that are specific to them and their situation.
That's right. And also, if you scan that QR code, you can book a consultation with our team. You can choose the time of your convenience in order to speak with one of our licensed Medicare advisors. There's no charge for our service, and we're going to help you evaluate every insurance company and every plan available to you based on your 3 Ps.
That's great. That's why we love you guys. That's why we're sending people to you.
We love you too. So a question asked in advance, I like my current plan. Do I still need to schedule a Medicare consultation? I would strongly encourage you to do so. Here is your checklist. First, over the last 3 or 4 weeks, if you're already on Medicare, you should have received an annual notice of change. This will describe how your plan is going to change for 2026. Second, write out your 3 Ps. Write out your providers, your prescriptions, and your priorities. And then third and finally, schedule your free Medicare consultation with the chapter team. You can do it by scanning the QR code or by reaching out to your Mariner advisor or simply by emailing us at mariner@askchapter.com. So this is how Chapter empowers Mariner clients during life transitions. 3 buckets. First, for those of you who are turning 65 before the end of the year, we'd love to help you start your Medicare. It is a 5-minute process to do online. It's fast, safe, and secure, and it certainly beats calling the Social Security Administration call center where you'll wait on hold for over 90 minutes. And sometimes I've heard of people waiting on hold for well over 3 hours.
So that's huge, Ari. I mean, they're asking in the chat, I've got to do it now. We're telling them, go to Ask Chapter, and they will help walk you through signing up for Medicare.
That's right. If you haven't started Medicare yet and you're turning 65, we will help you sign up for Medicare. We'll do it end to end. We'll help you get your red, white, and blue card. We'll walk you through option 1 or option 2 based on your 3 Ps. Then we'll help you submit the paperwork to the insurance company of your choosing, and we'll provide year-round ongoing concierge support through our member advocate team. So if you misplace your ID card, you call our member advocate team. If you have a question about a claims invoice from a provider, we'll help you decipher it. If you're charged an outrageous copay at the pharmacy, we'll get to the bottom of it. Our member advocate team will help you fight for anything that comes up post-enrollment.
So I want them to hear that and understand that this isn't just a one and done, but they can also go back to Ask Chapter if they have confusion along the way with claims when they're working with their plan.
Always. That is the type of ongoing concierge support that
Right.
Chapter provides. The second bucket of clients that we support are those who are past 65 and you're planning to retire soon. The only exception for delaying Medicare is if you or your spouse work for a large employer with 20 employees or more. Rule of 20. So if you or your spouse work for an employer with 20 employees or more, then you have an exception to delay starting Medicare. If that does not describe your situation, then you probably need to start Medicare by way of turning 65. So for example, if you're 64 years old and you're watching this presentation and you're an independent contractor, or you're self-employed, or you run a small business, or you work for an employer with fewer than 19 employees, you need to start Medicare by way of turning 65. And then the final bucket of clients that we support, and what a lot of this presentation has been geared towards, those who are already on Medicare. We will help you review your coverage for 2026. So with that, we're going to turn to some frequently asked questions. If you have a personal situation that you want to go into more detail on, please feel free to email us at mariner@askchapter.com. It is a staffed inbox, and that's if you don't feel comfortable raising your question in the chat, please go ahead and email us at mariner@askchapter.com.
And I'll continue to say that if they don't get answered in the chat, because it is a large number of people are on this call, then you can always take that same question out to mariner@askchapter.com and be able to get that answered personally for you. So if your prescriptions haven't changed, do I still need to review coverage starting October 15th? What about my prescriptions?
The answer is yes, because even though your prescriptions might not have changed, the plans are changing and the regulations are changing. So I would still strongly encourage you to review your prescription coverage before December 7th.
Yeah, I saw a question out there where they thought that their drug plan changed by 1,000% and they wanted to know if that was a typo. Could that be possible?
1,000% seems very, very high.
Very high, me too.
I've seen plans increase by 4x, and let's review all the
So
plans
they
that
should
are
email you.
available.
They
Yes,
should email you
absolutely.
and ask specifically about their drug plan.
Yes, yes. The next question is, can I use the annual enrollment period to switch to a Medigap plan? And the answer is yes. In 46 states, you are time restricted as to when you can sign up for Medigap without questions about your health history. So in 46 states, there's a one-time opportunity for you to choose option 1 without any questions about pre-existing conditions, and an insurance company can't price discriminate against you. Now, you can shop your Medigap plan at any time. You're not constrained by the annual enrollment period in order to do so, and it takes less than 5 minutes in order for us to run a price check for you. But you should know that in 46 states, you may have to answer questions about your health history. The only 4 states that have an exception here are New York, Connecticut, Massachusetts, and Maine. So they're all along the northern Atlantic coast. New York, Connecticut, Massachusetts, and Maine. In those 4 states, you don't have to answer any questions about your health history.
This is why we use you, Ari, because you have all that stuff memorized and it's so good and sharp. You're on point with all of it. What
Thank
about
you.
the next question? I'm past age 65. I'm planning to continue working for at least another 2 to 3 years. Do I need to still enroll in Medicare Part B?
The answer is no, so long as you or your spouse work for an employer with 20 or more employees. Rule of 20. If you or your spouse work for an employer with 20 or more employees, then you have an exception to delay starting Medicare.
This next one is out in the chat as well, which has to do with IRMAA-related problems. So one of the questions was whether or not, they get surcharges if they're on Medicare Advantage. IRMAA is on any income. It has to do with income, not which plan you're on. And we do a lot of this with clients. What is the income-related monthly adjusted amount, IRMAA, and who does it apply to? How does it affect us?
Yes. So the income-related monthly adjustment amount is referred to as IRMAA. That's the government's acronym for it. I love the government's acronyms, don't you?
That poor woman, that name, now it's this Medicare name.
Yes, yes. So the standard Part B premium for 2025 is $185 per month. But if you're a high earner, then you are assessed 2 wealth taxes, 2 surcharges. So who do these surcharges apply to? Well, the government looks at your tax return from 2 years ago. So for this year, the government is looking at your 2023 tax return. And for next year, the government will be looking at your 2024 tax return. And for this year, the government considers you a high earner if you're a solo filer and you earn more than $106,000 modified adjusted gross. Alternatively, if you're a joint filer and you earn more than $212,000 modified adjusted gross, then the government considers you a high earner, and it's graduated. But I do want to emphasize that there's actually 2 surcharges. There's one on Medicare Part B, and there's another on Medicare Part D. And even if you choose a Medicare Advantage plan, you still will owe IRMAA if you're a high earner. And I have good news. This is something that we help you appeal. If you have a life-changing event and the Social Security Administration spells out 8 life-changing events, then we can instead request that the government look at a more recent year because they're looking at stale information. They're looking at your tax return from 2 years ago. And if you've experienced a life-changing event, the 2 most common are work stoppage or work reduction. And sadly, the 3rd most common is divorce. You can appeal your IRMAA, and it's something we're very successful at helping you appeal. It's something our team really spends a lot of time on because it's important to you. And if a couple wins their IRMAA appeal, they can save $10,000 to $12,000 per year.
Now, we help with this one as well. And we are always telling people to look at the SSA 44 because as they make this transition, as they apply for Social Security, they are able to say, hey, look, reduce it sooner. I shouldn't have this hit because I don't have this money now. And we also tell them to look for the W-4B because that tells them to voluntarily withhold money from Social Security taxes. So these forms are out there on the IRS website, and you can pull them down and fill them out for yourself. Sometimes people ask, does it work if they have capital gains? But you'll notice on this list that Ari is showing, capital gains just because it's a one-time event still means that 2 years from now, they're going to say you made more money. And for 1 year, you'll have an increase in your IRMAA. And when you look at those bands, and you can go back maybe to the bands chart for them for a second, Ari, it's important for you to realize which band you're in, because most people get it as a hit kind of as they come in the door for the next year, 2 years later from when it happened. So most people understand IRMAA when it happens to them. They don't always understand IRMAA before it happens to them. So in a lot of our planning, we try to show them, gee, if we're going to take this capital gain, it's going to throw you into IRMAA. Oh, by the way, muni bond income accounts. So even though muni bond income is not taxable, it does count for IRMAA. So you kind of want to see how you're bubbling up to that IRMAA threshold and which of these you're going to pay. And sometimes it's worth it. Sometimes we'll do a strategy where, yes, you're going to pay $5,000 for Medicare this year, but this other strategy is going to make us much more money. An example of that might be Roth conversions. So IRMAA is something we pay large attention to. It is part of the conversation. And it also, I think I see out here in the chat some questions too of, should I do Medicare? Should I do my insurance plan at work? And I ran into this exact problem with our family, with my husband, because of our income right now, we would be paying the highest IRMAA rate, which is actually pretty much equivalent to what we have to pay for our deductible. So it isn't an advantage to go to Medicare.
That's right. You have to look at the complete financial picture. All right, so let me put up the QR code. Through the QR code, you can get an updated copy of It's Not That Complicated, and I'm actually going to update it again once the government releases the numbers for 2026. They have not released them yet as to what the Part B premium will be or what the IRMAA brackets will be. But once that is updated, then I will also publish a new copy of It's Not That Complicated. So if you'd like a copy of the book, please scan the QR code, and we'd be more than happy to email you a digital copy. So just like you would at a menu, as Chad mentioned, point your phone at the QR code and it'll ask you a couple questions, and then we'll email you a copy of the book.
Thank you, Ari. That's good timing. I know we had a couple questions about this, asking for this. So we've got the QR code there. That we had probably the most frequent question has to do with timing, and there's all kinds of variations on this. So, so people giving their ages and when they turn 65, someone turning 65 in January and asking if they have 3 months after that to sign up. Some people turning 65 in February, March, July. They're all asking if they can sign up during open enrollment. Can you help shed some light on this? So many people listening right now that that turn 65 somewhere in between now and next year.
Yep. So the annual enrollment period is for those who are already on Medicare. So if you see, you're going to be served nearly 10,000 commercials about the annual enrollment period per day. And just know that the annual enrollment period is for those who are already on Medicare. They already have a red, white, and blue card. Instead, if you're turning 65 in the near future, you will need to sign up to activate your Medicare. So for the person who's turning 65 in January, you are in your initial enrollment period right now. It begins 3 months before the month in which you turn 65, and it extends to your birth month and 3 months after your 65th birthday. But you don't want to wait, because if you wait, then what insurance are you going to have in the interim? You might say, I'll COBRA, but COBRA is only secondary to Medicare. You need to activate Medicare as your primary insurance in order for COBRA to work. So that is one of the costliest mistakes that we help you avoid. The assumption that COBRA is a replacement for Medicare. No, COBRA is only secondary to Medicare.
Great. Thanks for elaborating on that. There are some questions about switching plans, and I guess the essence of some of them is how hard is it to move back from Medicare Advantage to Medigap, for instance, was one of the questions. Like the logistics and just everything involved in moving from one to another. How difficult is that?
So that's exactly what our team is here to support. In 46 states, you may have to answer a few questions about your recent health history, but it's not like a life insurance exam. There's not a nurse that comes and measures your vitals or draws your labs. Instead, it's a few questions about your recent health history, and these vary insurance company by insurance company. But it is very possible to move from Medicare Advantage to Original Medicare and to then choose a Medicare supplement plan and a standalone prescription drug plan. In fact, that's what the annual enrollment period is designed for.
And I am seeing, again, a lot of questions that are very specific to each person and want you all to know. I sent my mother to Ari directly. I was like, you go ask chapter, because literally it was the difference between, should I do this F plan that they're phasing out, but C looks a lot like F? And, my eyeballs start screwing around in my head too. And she's got the book open that's the soft paper that's like tissue paper. And it's great night reading for falling asleep, but it's very hard to figure out what you're supposed to do, especially with the pressure of that enrollment window. So I encouraged her to come to you all because then you can figure out what are the medications, what are the doctors they go to, and then help determine what really is the best plan for each individual person.
That's right. And I wanted to put that email address up in case someone has a personal situation that they want to get into. By all means, please email us at mariner@askchapter.com.
Someone asked about the government shutdown and, if they're applying for Medicare today for coverage to start in January, is the shutdown having any effect that you know of or you're aware of?
The shutdown will not affect your ability to apply for Medicare. The Social Security Administration is continuing to process Medicare applications. I saw someone approved within 72 hours just last week.
I also saw a good one. How does Ask Chapter get paid? People, you don't get free lunch. How does this work? Why are we getting all this help from Ask Chapter?
Yes, we earn revenue from insurance companies, and it does not matter which insurance company you choose. All that matters to our advisors is making the single best fitting recommendation based on your 3Ps. Our platform has every insurance company and every plan, and our advisors are blinded as to which plans Chapter earns revenue from and which ones we don't. So that's how we create a fiduciary-like duty to you.
Can each spouse elect different plans?
Yes, that happens all the time.
The other thing I'd say is a lot of questions about how to connect with someone, and we mentioned how to reach out to chapter directly, but also if you're on this call, you received an invitation from someone at Mariner. So we would also encourage you to just respond to that email and follow up, and that advisor can help get you connected as well.
I see one too out there, Chad, that it's specific, Ari, where certain physicians aren't accepting them as a patient because they're not involved in the right plan that applies to that secondary billing insurance. They're wondering, is that something you can help them navigate? Can you answer those questions for them?
1,000%. We can help you find a plan that would include your trusted providers in network, or if your trusted provider accepts original Medicare, then we can look at your options for choosing a Medicare supplement plan, for example.
There was also a question, and it's a good one, and it's a little bit more complicated when they're on Tricare, when they're military. So talk about that.
Yes, so Tricare for Life is for retired service members. It means you served our country for 20 years or more and you retired with the military. So if you have the option of Tricare for Life, then all you need to do is activate your Medicare. You will then receive a $0 Medicare supplement plan from the Department of Defense, and you'll also receive excellent prescription insurance. So all you need to do is activate your Medicare. That's it.
Did we say how much premiums are going up for Part D this year? There's some question about that amount and how much is that amount?
Yes, there are many, many Part D plans that are increasing their premiums for 2026. Would need to know more about which plan you were on for last year in order to evaluate how your specific prescription plan is changing for 2026. But that's something that our team would be more than happy to help you with.
Along those lines, I mean, definitely some questions just asking why these Part D premiums have increased so dramatically, 100%, 1,000%. I don't imagine that, Ari, you're able to answer why necessarily, but if you have any insights there, that's something that people are wondering. If that's whatever's causing that, is that something they need to think about continuing or?
Yeah, there are several reasons for why we're seeing Part D premiums increase for 2026. Namely, the prescription drug insurance companies' costs are going up, primarily as a result of the maximum out of pocket of $2,100. That cap that's being placed on Part D is also increasing costs for the Part D insurance companies, but the regulations are changing as well. And those types of regulatory changes are increasing costs on the Part D prescription insurance companies.
How much is it state specific, Ari?
It's not just state specific. It actually, the plans vary county by county,
Oh,
depending
wow.
where you live across the United States. And so
Mhm.
there's over 24,000 plans nationwide. And so what we do here at Chapter is we help you evaluate every insurance company and every plan offering available in your county. Look, the Medicare industry is broken. That's why we started Chapter 6 years ago. And it's personal to me because I saw it firsthand with my parents. And Lisa, I know you see it with your mom. There
Yep.
is so much misinformation out there. And not only that, there's broken incentives. Many people are being bombarded by captive agents through unsolicited phone calls, spam text messages, and direct mailers. And if you walk into a Ford dealership, what are you going to walk off the lot with? So that's why, whatever you do, work with someone who's independent and unbiased and can help you sort through all your options.
And again, that unbiased part was really important to me because through a lot of years before we had Ask Chapter to come to, so thank you for starting your business. There would be people at the local hotel that would come out of the woodwork during open enrollment, and those people would be associated with some other insurance company or agency or annuity company. And so the clients would use them, but then they would also be solicited to buy something else. So this is a clean ask for them. It's just about their Medicare. It's just about them. And there is no further solicitation from you for any other product for them, which is nice.
That's correct. And then also, we provide year-round ongoing support. You're always welcome to call the chapter Medicare advisor that you work with. And you also are supported by the chapter member advocate team, which is here to help you with any post-enrollment issues that come up. And we know hiccups come up along the way. Sometimes insurance companies code things wrong, or sometimes they mischarge you on a copay. Instead of calling the insurance company, you call our member advocate team and we get to the bottom of it on your behalf.
There's also an interesting question out here about AI and using AI to pre-qualify people for Medicare. Have you heard of that yet?
Yes, so that's happening in a limited number of states. There are 6 trial states where the government is doing that, and it's only for very specific items, for example, wound bandages, that tend to cost original Medicare a lot of money. And so they're looking for ways to contain costs for those types of services.
So people are mistrustful sometimes of AI and questionnaires like that. How do you feel about those programs? Is that something they can feel comfortable trying, or should they just call you?
Well, original Medicare is using, the government is using those services in 6 states as a trial, and it's
Mhm.
only on very specific services. And of course, if you get denied for one of those specific services, we'll see what we can do to troubleshoot the issue if you still want to receive, for example, that wound bandage.
Got it.
Couple more questions just about chapter. Is chapter licensed in all states? Is one question.
Yes, we're licensed in all 50 states, including the District of Columbia.
And then someone's asking, what is the best way to prepare if they were going to meet or talk with you and your team?
That's a
What
good
should they
question.
be equipped with there?
The
The
three
three
P.
Ps, your providers, the list of doctors that you want to see. Lisa, thank you. Your
And,
prescriptions, what medications you take, and finally your priorities, what's important to you for the upcoming year.
and someone wanted to know what the three Ps are, so perfect. All right, we're working through these. Like we said at the beginning, we're definitely not going to get to everyone's, and a lot of these are, Lisa mentioned, they're very specific to your situation, which is a great for an individual outreach, but a little bit harder to handle in this format.
Just to say again, we will be sending this back out. The slide deck will come out. It probably will come out within about 10 days. Takes a while for it to go through our compliance approval, and then it goes back out. Ari, you might want to also show the disclaimer slide too a little bit, and then back to the Ask Chapter slide. And again, you can always go back, as Chad mentioned, to your advisor and ask your advisor to help you get connected with Ask Chapter. Ari, if we wanted to be on the call with our client, can we do that when they schedule their appointment with you?
Yes, if the client opts for a Zoom consult, then the Mariner advisor is more than welcome to join the consultation.
That's great. That's a good question too out there. People are asking, does the plan change as soon as they make their change, or does it change after December 31st? When does it kick in?
That's right. Any change you make during the annual enrollment period will take effect January 1st.
And then there's another really good question, and I know this one too, but if somebody is currently eligible for Medicare, but they're actually on their spouse's work insurance, but then if the person retires mid-year, what happens? It's usually an event, and so they're usually allowed to do something, but how does it happen? What happens, Ari?
That's right. If you've been on yours or your spouse's work provided insurance, you can start Medicare at any time. You don't have to wait until your company's open enrollment period. So in this situation, when you or your spouse, if you're waiting until retirement, then a month or two before you retire is the time to reach out to the chapter team, and we'll help you activate your Medicare and then go over your options for additional coverage and help you submit all the paperwork. So that way you don't experience a gap in your insurance.
So to review again, open enrollment is for people who are already on Medicare.
That's right. The annual enrollment period, which is October 15th to December 7th, is for those who are already on Medicare.
It's your chance, your window to make your changes. But if you're
Yes.
planning to retire, or if you've had some of those other things that we mentioned, a life event, a death, a change of your husband's retiring, your wife is retiring, those are life change events that qualify for being allowed to make your changes when that change occurs.
Correct. And
These are
let me
all really
put the
very good
book
questions.
QR code up one more time
I think
for
that's
those who
smart.
weren't able to scan it.
Yeah, and once again, I want to thank everyone for attending. We had not only great attendance, but really good questions, really thoughtful questions. It's helped make this, I think, a lot more useful for everyone else, to get some insight there. And I want to thank you again, Ari. I know that this is a big day, and we're grateful that you share a little bit of time here with us. And Lisa, thanks for joining. So with that, we'll sign off. Like we said, we'll have a copy of this recording. Everyone should receive it within the next week or so. And if you have any follow-up questions, just reach out to that Mariner contact who helped get you here in the first place. So thanks, everyone.
Thanks, Chad. Thanks, Ari.
Thank you so much, Chad and Lisa.